Good afternoon, everyone. Today, I'm here to talk to you about coping with postpartum depression and anxiety. Postpartum depression and anxiety are serious mental health conditions that can affect new mothers, and it's important to know how to recognize the signs and symptoms, as well as how to seek help and use coping strategies. 1. Definition of postpartum depression and anxiety. Postpartum depression and anxiety are mental health conditions that can affect women after giving birth. Postpartum depression is a type of depression that can occur after childbirth and can cause feelings of sadness, hopelessness, and disconnection from the baby. Postpartum anxiety is a type of anxiety that can occur after childbirth and can cause excessive worry, fear, and nervousness. 2. Prevalence of postpartum depression and anxiety. Postpartum depression and anxiety are more common than you might think. In fact, it's estimated that up to 1 in 7 women experience postpartum depression, and up to 1 in 5 women experience postpartum anxiety. These conditions can happen to anyone, regardless of age, race, or socioeconomic status. 3. Importance of seeking help and coping strategies. If you're experiencing postpartum depression or anxiety, it's important to seek help. These conditions are treatable, and with the right treatment and coping strategies, you can start to feel like yourself again. Some coping strategies that we'll talk about today include self-care practices, building a support system, therapy options, medication options, and mindfulness and relaxation techniques. 4. Signs and symptoms of postpartum depression and anxiety. Let's talk about some of the signs and symptoms of postpartum depression and anxiety. A. Physical symptoms. Changes in appetite or sleep, fatigue, headaches, or body aches. B. Emotional symptoms. Feeling sad, hopeless, worthless, or guilty, or feeling excessive worry, fear, or nervousness. C. Behavioral symptoms. Withdrawing from loved ones, losing interest in activities you once enjoyed, or having trouble bonding with your baby. 5. Risk factors for postpartum depression and anxiety. While anyone can experience postpartum depression or anxiety, there are some risk factors that can make it more likely. These include: A. Personal history of depression or anxiety. B. Lack of social support. C. Pregnancy and childbirth complications. D. Hormonal changes. 6. Coping strategies for postpartum depression and anxiety. Now let's talk about some coping strategies for postpartum depression and anxiety. A. Self-care practices. Taking care of your physical health through sleep, exercise, and nutrition can help improve your mental health. B. Building a support system. Reaching out to family, friends, or mental health professionals for support can help you feel less isolated. C. Therapy options. Talk therapy, cognitive behavioral therapy, and group therapy can help you develop coping skills and strategies for managing postpartum depression and anxiety. D. Medication options. Antidepressants and anti-anxiety medication can be helpful in managing symptoms of postpartum depression and anxiety. E. Mindfulness and relaxation techniques. Meditation, yoga, and deep breathing exercises can help reduce stress and promote relaxation. In conclusion, postpartum depression and anxiety are common mental health conditions that can affect new mothers. If you're experiencing symptoms, it's important to seek help and use coping strategies to manage these conditions. Remember, you're not alone, and there is help available. Thank you for listening, and please don't hesitate to reach out for help if you need it. Thanks for watching. We appreciate your support and hope you found this video helpful.